I think heartburn is so common that many people assume that it's a normal part of life. And the truth is it's not, and you shouldn't be experiencing heartburn frequently, and it could be a sign of something more serious going on in your body. Stomach acid is important because it helps us digest and break down our food. It also helps us fight off infections, so any sort of bugs that we may ingest accidentally with our food, stomach acid is there to kill it off so it doesn't make us sick. Stomach acid is very corrosive, it's very acidic, and that can be very damaging to the delicate lining of your esophagus. Esophagitis means inflammation of the esophagus, and this is one of the common consequences of acid reflux. And if we take a tiny sample or a biopsy, we will see signs of inflammation in the esophagus. If you have chronic inflammation due to acid reflux, sometimes that inflammation gets so severe that it actually causes a narrowing of your esophagus. You may have either pain or difficulty swallowing. Another potential complication of acid reflux is Barrett's esophagus. This is a condition where the cells in the lining of your esophagus actually change because of the exposure to acid to a more precancerous type of cell. GERD can actually erode your enamel, so your dentist actually may notice signs of acid reflux. For some people, it can cause bad breath, so it can actually affect your oral health as well. Some people actually experience respiratory symptoms because of acid reflux or worsening of conditions like asthma. And the theory here is that minute amounts of acid are coming so high up that they actually fall into the trachea or your windpipe and irritate your airways. If you have severe inflammation in your esophagus to the point where it's causing erosions or almost little tears in your esophagus or an ulcer, those can actually bleed, and you may see that blood in the stool in the form of red blood or very dark black stools. Getting the proper treatment for acid reflux does lower your risk of these types of complications, but it doesn't eliminate it altogether, which is why it's important to continue to follow up with your doctor.